Ladies and gentlemen of the legislature, good afternoon. I am here to present a policy on workplace and public accommodations for nursing mothers. Various federal laws and state policies protect nursing mothers, but gaps in the law remain. This policy both benefits the mother and the infant. There is a widespread of scientific agreement that breastfeeding is beneficial for both infants and their mothers, and national public health goals reflect increased attention to helping ensure that mothers and babies have the opportunity to experience these benefits. Various legal and policy approaches for promoting, protecting breastfeeding have accompanied the evolution of evidence and the development of national goals. This policy provides an overview of the various federal and state laws concerning workplace and public accommodations for nursing mothers in the United States and identifies the gaps that persist between public health goals in reality for breastfeeding women in this country. Many public health professionals and healthcare providers promote breastfeeding as a means to improve infant and maternal health for children. For children, the antibodies in breast milk can help combat bacteria and viruses, which can result in fewer ear, respiratory, and urinary tract infections, as well as frequent episodes of diarrhea. Breastfed babies are 36% less likely to die from sudden infant death syndrome, and 55% are less likely to become obese later in life, compared with babies who are not breastfed. Many analyses also demonstrate an association between breastfeeding and lower healthcare related costs. Likewise, mothers can benefit from breastfeeding. Studies have found that women who breastfeed return to their pre-pregnancy weight more quickly and have a lower risk of premenopausal breast cancer, ovarian cancer, and osteoporosis. The Centers for Disease Control and Prevention estimated that 79% of mothers initiated breastfeeding after giving birth in 2011, but merely a fraction, which is 19%, were still exclusively breastfeeding 6 months later. This falls well short of the recommendations from the American Academy of Pediatrics, which supports exclusive breastfeeding 6 months and continued breastfeeding through at least the first year of life. Actions by states and the federal government, including provisions of the Affordable Care Act, which is ACA, and the Healthy People 2020 initiative, aim to increase those numbers to a national goal of 81.9% of mothers initiating breastfeeding and 34.1% continuing to breastfeed through the postpartum year by 2020. Frequently, with nearly half of new mothers working outside the home in the year after giving birth, 2/3 of these women are employed full-time. Employment is a frequently mentioned barrier to breastfeeding for women without medical contraindications. In addition, women who intend to breastfeed face a slew of cultural and institutional impediments to breastfeeding, including lack of family support and social support, lack of education regarding the benefits of breastfeeding, being discouraged from breastfeeding in public, and a lack of hospital support for breastfeeding initiation. There are wide variation among states in their residents' breastfeeding initiation and duration. In general, Western and Northwestern states have the highest rates of breastfeeding initiation, with states in the southeastern part of the country having remarkably lower breastfeeding rates. Demographically, Latina mothers are the most likely to initiate breastfeeding. African American infants have lower rates of breastfeeding initiation and duration compared to white and Latino infants. The racial gap and ethnic gap, however, has declined substantially since 2000. Breastfeeding rates are significantly higher among infants in families with higher incomes, which is 74%, compared to those families with lower income, which is 57%. Federal and state laws to protect or promote breastfeeding generally relate to three areas: health insurance coverage for breastfeeding support and supplies, workplace accommodation, and public accommodations. The ACA, enacted and signed into law in 2010, contains several provisions intended for breastfeeding to support breastfeeding, including coverage for lactation support products and services by most insurance plans, and an amendment to the Fair Labor Standards Act, which is the FLSA of 1938, to provide women time and space to express breast milk. First, the ACA requires most health insurance plans to provide coverage for certain health services for women at no out-of-pocket cost. These services include breastfeeding supplies, such as breast pumps and milk storage bags, and lactation counseling associated with each birth. However, these federal requirements do not apply to insurance coverage under the Medicaid program, which covers low-income women who have disproportionately lower rates of breastfeeding. Based on 2012 survey, with 44 states responding, 25 states Medicaid programs covered breastfeeding education services, 15 states covered individual lactation consultations, and 31 states covered equipment rentals. While insurance coverage without cost sharing for these services may certainly assist women in paying for supplies and learning about initiating breastfeeding, the ACA's change to FLSA may have impact on breastfeeding duration, especially for employed women. The FLSA may have FLSA to incorporate a reasonable break time for nursing mothers into their workday, and requires that many but not all employers covered under the FSLE provide reasonable break time. The FLSA, however, applies only to certain U.S. employers who engage in interstate commerce and have a gross revenue of $500,000 a year. Furthermore, the provisions apply only to non-exempt from Section 7 of the FLSA employees who are typically hourly employees. Additionally, employers with fewer than 50 employees can seek an exemption from these requirements if compliance will place an undue financial hardship on the employer. The Department of Labor encourages all employees to provide these accommodations regardless of whether they are required by law. The penalty for violation of Section 7 is generally to compensate the employee for lost wages. But since the employer does not have to pay the employee during the break time that she is pumping or breastfeeding, the provision effectively has no enforcement mechanism. The FLSA amendment preempts any state law affording less protection to breastfeeding mothers, but does not limit states from providing greater protection. 27 states and Puerto Rico provide similar laws to the ACA's provisions. States have also done much work to enact legislation and specifically protects the right of women to breastfeed in public or private locations. For example, while most laws explicitly allow breastfeeding in any place where an individual has the right to lawfully bleed, some states do not place restrictions on this. California excludes a private home or residence of another. Massachusetts states allows private action, the ability for civil lawsuit. 29 states of the District of Columbia and the U.S. Virgin Islands additionally exempts breastfeeding from public indecency or law conducts. I'm here today to plead on the behalf of all breastfeeding mothers and their infants that this policy should be made nationwide and that all employees, regardless of gross revenue, should be required to pay mothers for time used to express milk. Furthermore, breastfeeding mothers should be allowed to breastfeed in public as needed by their infants. It helps mothers to be at ease without public scrutiny. Therefore, if this policy becomes federal, it takes away the rights of each state to make their own policies and laws regarding breastfeeding. Thank you, ladies and gentlemen of the legislature, and I hope my policy will be taken into consideration and voted on.